Hi, my name is Dr. David Bowen. I'm a board-certified plastic surgeon with specialization in surgery of the hand. I've been doing this for almost 30 years, and I've been here at Kern Medical for about the past 8 years. We are the only hand surgeons in Kern County that are available 24/7 for all emergency needs, so we cover a large territory. And I'm very grateful to be able to talk today about firework injuries and the devastating nature of them and what they can do to a person's hand. I think the important thing for most people to realize is that this can happen to anyone, and that these injuries can be life-threatening as well as life-altering, to the point where it can alter your ability to use your hand for the rest of your life. And I think it's important that people realize that, yes, this always happens to the other guy, but the reality is that it can happen to you. And my message to anyone watching this is to not handle fireworks yourself. Leave it to the professionals and keep a distance. And certainly do not mix alcohol with fireworks, because my experience has shown that that combination is the most lethal. So these injuries, I can recall back in 2021, July 4th that year, we had probably 4 of the most devastating hand injuries I've ever seen in my 30-year career. And these injuries, you would expect to see them on the battlefields of Iraq or Afghanistan. They were that bad, with digits blown off, half the hand blown off, significant soft tissue, tendon, bone injury, and all of them were from people handling fireworks, either having just lit the fuse to throw them, or they lit the fuse and it didn't go off and they went and grabbed them and they detonated. And I also want the public to be aware that this is not just an adolescent type injury. That 4th of July I mentioned a few years ago, one of our patients was a 38-year-old female. So this can happen to anyone, and it's not just related to young people. It happens to adults. Many times adults think they're supervising the kids' fireworks show and they get injured. So this can happen to anyone, and remember that. And if you think about it, it's always the person's dominant hand that gets injured, because you don't pick up something with your non-dominant hand generally and throw it. So all of these injuries tend to occur to a patient's hand that's their dominant hand, and that's even more devastating to someone's hand function going down the road. Many of these injuries require multiple operations. The recovery time from them can be years, not months, and the impact on their ability to earn a living and live a normal life are dramatically affected in an irreversible fashion. So my message to the community is, please don't handle fireworks. Please don't drink alcohol and handle fireworks. Enjoy fireworks from a distance and leave it to the professionals. Because always remember, there's really no quality control on these street-bought fireworks. How long the fuse stays lit, whether they detonate, whether one makes a big bang or another, you just don't know. So you're really rolling the dice and playing roulette with a lot of these street fireworks, and I want everyone to have a safe and happy and healthy 4th of July.